Hello, I'm Michael Pierce, and this is The Human Condition. Our topic today is chelation, testing, and therapy. We're going to get into when to do it, why to do it, what it is, how it works, all of that stuff. And so I'll unpack the process because there's parts of it that can be really good, and there's parts of it that might be risky. So we've got to talk about it. It's not a bad thing or a good thing, it's just a tool. And so sometimes it's really great, and sometimes it really messes people up. So we've got to talk about that whole aspect of all those things. Let's begin by talking about why we would do a chelation test. So, a medical doctor might ask a person to do a chelation test if they've seen that their blood work showed an acute exposure to heavy metals. Now, I've said before in my channel that heavy metal exposure is usually only acute and showing up in the blood for about 9 weeks after a toxic exposure. And most of what we know about heavy metal poisoning in humans comes from mining and industrial and commercial exposure of that kind of nature at work, like the OSHA kind of thing. So when a person gets exposed to heavy metals, they get elevated levels in their blood for about 9 weeks, and then the body sequesters or shoves away all those different metals into different pockets or different areas or chambers of their body. The bone, the fat cells, the different organs at different rates, the brain, the spinal cord, peripheral nerves. Every organ gets different amounts of different heavy metal. And so your body stores in some unpredictable ways different heavy metals in different places. It doesn't go all in the same place or all at the same rate. And some of it's locked up tighter than other parts. So, a holistic doctor is usually going to use a hair test to look for chronic exposure because that's a really good way to look at it over the course of 3 or 4 months of chronic exposure of hair growing out and expelling these heavy metals. So, blood is great for acute, hair is great for a chronic exposure. And then we do urine and stool testing to look for almost immediate daily and hourly release of these molecules, these heavy metals, to see how the clearance is, how it's coming out. So why would we do a chelation test? We would do a chelation test if a medical doctor suspected that a person had got exposure to heavy metals and that they were experiencing some kind of health effect, but they couldn't find it necessarily in blood. So they would do a chelation test to kind of goose the patient, to kind of shock them or prod them into releasing more of these heavy metals with a drug. So those drugs might be drugs like EDTA and DMPS and DMSA. And I'll just mention that EDTA is mostly for lead and cadmium and mercury. DMPS is mostly for mercury and arsenic and lead, and DMSA is mostly for mercury and lead, and EDTA is for calcium too. So when a person's trying to get rid of heavy metals, the doctor is trying to match up which metal goes with which chelating agent that goes intravenously into the arm in order to try and heroically pull that heavy metal out of the tissue. Now, that can be a good idea for people that are suffering, but it can also mobilize heavy metals that are stored in tissues at too rapid a pace and redistribute them throughout the body into the brain tissues and to the spinal cord. And so that is a problem. It is a risk. A lot of doctors will just do chelation therapy without the chelation push test because they know that the person is heavy metal exposed acutely, and they've got a blood test that shows that the heavy metals are high in the blood. So it's really the test is usually used when the doctor has seen that the patient's moved from acute to chronic and isn't really sure. Now, one of the reasons why we would do a chelation test is the patient might be one of those very rare people who genetically tend to hoard heavy metals in their tissues. And that would be somebody who tends to sequester heavy metals into their cells and don't give them up. They don't give them up and don't push them out of their cells at a rate that will show up in their blood and their bile and their urine and come out of their hair and come out of their body. And so they would have a lower level than typical of hair or urine or stool heavy metals, and certainly normal blood levels. So a doctor might do that if they suspect that the person has inherited a set of genes or SNPs that make them less likely to expel them. And perhaps they've even already done a hair test and found it to be extremely low in heavy metals, and yet the patient has a history of heavy metal exposure. So the doctor says there's not a matchup here. They should be full of heavy metals, and their hair is not showing a chronic exposure. So they do a chelation test to goose them to release those heavy metals. So let's talk now about how to do a chelation test. A doctor, this was done in a medical doctor's office. Chiropractors don't do this typically. This is done as a prescription or a controlled substance. It's an intravenous line. And so a nurse might do this or a medical doctor might do this in their office. And they would place an intravenous line, into the arm or hand. and run the chemical EDTA or DMPS or whichever molecule they choose into the patient, and then they would proceed to test them with some kind of urine testing to see how it's working, how much heavy metals are coming out and which one. And they've also got to be careful to check for electrolytes, because chelation drugs do deplete natural electrolytes and natural minerals that are in people's bodies. So it's really important for us to make sure that we have got good electrolytes during this process. Our doctor needs to check it in our blood. Our doctor needs to check it in our urine, and our supplements need to make sure that we've got enough of it. And in rare cases, if the person's really sick, the doctor may have to give intravenous minerals and intravenous electrolytes along with this kind of thing at different times in patients that are not doing so well. I kind of said some of that already, but when to do a chelation test is usually when the doctor is confused and the patient doesn't give the typical symptoms or lab results that say that they've got heavy metals. So the doctor wants proof. They want proof that the person has heavy metals because they're not getting it in blood and they're not getting it in hair. So they're suspecting that the person is typically one of those genetic hoarders that tends to not consciously hoard, but of course, just biochemically, their bodies just tend to hang on to these things. And it's a small group of people. It's not everybody that tends to do that. And you'll see that most likely in the most difficult mental health patients, in the most difficult autism patients. You'll see it in people that have very difficult combinations of SNPs, where the SNPs that they have in their genes add up and cooperate together to really form a bad deal for a patient and make them very susceptible to storing heavy metals and just not clearing them very well, despite trying to get rid of them and stopping ingesting them. What is chelation therapy then? So that was the test. Now we're talking about what is the therapy. And the therapy is really the same as the test. It's just you give a drug and then you measure the heavy metal coming out in their urine and try to see if it's coming out. And the doctor tries to balance, is there too much of the heavy metal target coming out in their blood? Is there too much of it coming out of their urine? Is there too much of it coming out or too little of it coming out? And they try to figure out the dosage and timing of these different chelation therapies with the patient to make sure it's safe, because you can detoxify too fast and you can detoxify too slowly. If you detoxify too rapidly, you can redeposit those metals in other tissues, as I said before, or you can flare up an autoimmune disease. You can flare up infections, because heavy metals tend to be fuel for things like cancer cells and viruses and bacteria and all kinds of stuff. So heavy metals and iron and other types of things that we move around in our body that are made of metals can fuel these organisms and these tissues. So we don't want to do that. It can also screw up our bowel flora. So we have to be careful that we're doing that. But chelation therapy is a series of intravenous placements and then measuring urine and sometimes blood to make sure that the heavy metals are coming out at the right rate, not too fast, not too slow, and that they're not losing electrolytes like sodium and potassium and other vital nutrients that are not heavy metals. So how is the chelation therapy done? Well, it's an intravenous line from a bag, and the bag has the drug in it, and the line is placed in the person's arm somehow, usually in the arm or the hand. And we've got a nice picture here, and it's pretty pleasant. It's pretty simple. It's pretty easy. You just you're usually sitting upright. You're usually not laying down, and it doesn't take terribly long. You have to drink plenty of water and make sure you have electrolytes in your life and in your diet, and then they're going to collect your urine. So they're going to use some kind of urine collection. Sometimes the doctor will work on a 24-hour urine where they'll give you a jug to take home and you'll pee in that for 24 hours, and they'll collect every drop of urine and measure it all. And you'll bring it to the lab as a big jug. Other times you'll just do a spot urine at certain times, and like this one on the screen here. And your doctor will analyze that and tell you how your urine is clearing out those heavy metals and the other electrolytes. Now, urine isn't terribly accurate for minerals and nutrients, although we do use it and we do use it as a guide, but it's not diagnostic for metals. I'm sorry, it's not diagnostic it's not really diagnostic for metals or minerals. We use blood or hair most of the time, but urine will help us understand the rate, because urine is only the last few hours, since the last time you peed, basically. So your ability to get rid of heavy metals from your urine only takes a few hours. So you're only getting a very, very local measurement. You're not getting something that's 3 or 4 months long. You're only getting a very quick measure. So it'll give you a spot shot of how much of the heavy metals are coming out. Is it too much? Is it too little? Is it just right? Or and are your minerals okay? So what are some of the benefits of this? It can be extremely beneficial. The benefits of chelation therapy is a rapid detoxification of heavy metals. and heavy metals are pretty poison. So as long as you haven't mobilized them and shoved them into other organs, which is a risk, then chelation therapy could be good. It could really pull things out, and it's turned a lot of people around. Unfortunately, it also has risks, and sometimes it doesn't go so well. And it can flare an autoimmune patient if they're not very stable, or somebody that's got active thyroid problems or inflammation or other types of difficulties. They might be flared by a chelation therapy, but sometimes they can benefit. Chelation therapy can be oral too. You can do oral chelation therapies by taking all manner and form of different substances. You can do chelation therapies with green substances. There's all kinds of herbs that you can take, and various different formulas. You can chelate, or you can bind with adhesion or adsorption, which is basically the sticking of a heavy metal to something. And you can use things like cracked chlorella, which is a green plant. You can use chlorella, you can use spirulina, you can use parsley and cilantro. You can use activated charcoal. You can use really any binder. Some people use diatomaceous earth, food grade, really anything that has a lot of surface area that can be dissolved in your intestine. Some people use fiber. I'm not a big fan of fiber because of the many problems of fiber, and I've talked about that in other videos. So there can be benefits to both oral and intravenous chelation therapy. And some people even do rectal chelation therapy. They put these things in the rectum in a retention enema, and they do that to clean them out of their intestine. So there's all kinds of ways to do this with these natural substances, and it's just a matter of discussing it with your holistic doctor and with your traditional medical doctor about which form is best for you and safest for you with the lowest risk. And so, can it really improve your overall well-being? Well, yeah, I mean, it can improve your overall well-being, but it can also give you a really bad day or month or year, depending on how sensitive you are. If you're really, really sensitive, we try to get a person much more stable by reducing their inflammation, by giving them anti-inflammatory herbs, by checking their blood for interleukin 6 and other interleukins, which are cytokines of inflammation, and seeing if they've come down. We look at CRP, which is C-reactive protein, and homocysteine, and hemoglobin A1C, and oxidized cholesterol. We look at all these different things to see if their body has calmed down enough to handle the stress of intravenous chelation therapy. So we also look at autoimmune results and see if their autoimmune flares have calmed down. Now, maybe antibodies might not have calmed down, but a lot of the symptoms of autoimmune reactions and responses may have calmed down. And so that may be one way that doctors will use to say, yeah, you have a more higher likelihood of being ready for intravenous chelation therapy because you're stable. If a person's really unstable with their symptoms and they're not doing very well, they may not do so well with intravenous chelation. They may want to start with a lesser one. Now, intravenous is fast, but that's part of the problem. It's so fast. Amy Yasko, the famous doctor who talks about autism and children with autism who don't speak and who are profoundly affected, she's the one that I've talked about many times that talks about SNPs and talks about detoxification very slowly. And she likes to detoxify people with heavy metals very slowly over the course of a year or two using oral chelation, using things like charcoal and other stuff. And there's different ways of doing that. So let's talk about who would benefit from chelation therapy. Most of the people that seek chelation therapy tend to be people that have had known heavy metal exposures, and people that may not have known they had heavy metal exposures, but they stumble on it because they've got some kind of intractable chronic disease. If a person, one of the rules of thumb in diagnosis is that if a person has some kind of problem that doesn't respond the way you think it should to drugs or to natural therapies or to detoxification methods or some kind of a treatment regime, one of the things that we say in diagnosis is look for heavy metals, because heavy metals are poisons that disturb enzyme systems in the body and genetic systems in the body, and they make the person break all the rules of biochemistry. So when somebody's behaving in a way that their body isn't responding right to supplements or drugs or therapies or things that should work on other people, suspect heavy metal toxicity. And so that's usually some people with all kinds of chronic illness may benefit from chelation therapy. Also, people with very bad dysbiosis, especially that have things like Clostridia. There are some bad bacteria and dysbiosis. If you get a urine test or a stool test that shows a real problem with the bacteria that live in your intestinal lining and also in the vaginal tract and in the sinuses, all these different places where all of these bacteria live, and fungi and all viruses and all that stuff. If you've got a real bad problem with regulating that kind of stuff, chelation therapy might be good for you at really turning things around. Whether it's oral or intravenous has to be your choice. Another group that might benefit from chelation therapy that's very controversial is the medical profession really didn't like this, but a number of years ago, people decided to use chelation therapy to remove calcium from plaque in arteries, and they thought that that might help them get better. And it's controversial, and cardiologists, you know, will some of them will vehemently talk about how bad it can be. I'm not going to advocate for using uh, chelation therapy to clean your arteries. It seems pretty clear that we can clean our arteries in a pretty short order by doing ketogenic and carnivore diets. And so obviously you have to talk to your doctor about this. But there's a lot of cardiologists on Low Carb Down Under, the YouTube channel, that really discuss this aspect of how to clean your arteries and get them clean. And most people without very rare genetic disorders can largely clean their arteries, either large arteries or very small arteries in their brain, with ketogenic and carnivore diets, as long as they're carefully constructed and not dirty keto or other kinds of things. And even in some cases, dirty keto will clean that. And that's for another discussion. Let's look at any risks associated with chelation therapy. And I've already mentioned that there are some risks. The biggest risk for me in my work is that a person might mobilize heavy metals from tissues that it's stored in and make it move to another tissue. And that other tissue would be worse. So let's say you've got it stored in your bone, which is relatively safe, and then it gets moved into your brain. So now you get neurosymptoms that are a little worse. So that could be bad. Or maybe more of it hits your thyroid and you've got autoimmune thyroid, and that organ's already inflamed. And so now you have more of a flare of autoimmune disease. So there are some risks associated with especially intravenous chelation therapy. There's less risk associated with oral chelation therapy because it's so gentle. You're not using drugs. You're just taking herbs basically, or things that are have a large surface area like charcoal and diatomaceous earth and all these different things. So how does it compare to other detoxification methods? Intravenous therapy compares with other detoxification methods in that it's rapid, it's a little more expensive, it's less accessible. There are some more side effects that can happen, and other detoxification methods can be really good. One of the things that I run into a lot is people that want to do the oral method, and so the oral method involves activated charcoal taken orally on an empty stomach at night, and alpha lipoic acid taken in the morning and throughout the day to try to act as a natural chelator to push those heavy metals out of the cells. Now, alpha lipoic acid can be very profound for some people, and for others, it can be really almost nothing. It's a chemical cousin of the B vitamins. You know, it's pretty benign for most people, but if you got a heavy metal problem, an alpha lipoic acid supplement dose can really, knock you back a bit. So be careful if you've never taken it before. Take a small dose first, not the 600 milligram that's a typical dose for helping with peripheral nerves and helping with liver recovery. Intravenous alpha lipoic acid has been used in Europe to help heal peripheral neuropathy of diabetics, and also to help heal people that have livers where the liver is so damaged that they need to be on the transplant list. And they can be taken off the transplant list sometimes and heal their liver sufficiently with intravenous alpha lipoic acid. Now, I don't do that. I'm a chiropractic neurologist, so I don't do intravenous therapy. I work with doctors that do intravenous therapy side by side quite a bit, and I've seen a lot of it. And there's a lot more to talk about on another episode. But this is available over the counter. It's not a drug. It's fairly safe. Some people do the charcoal alone without the alpha lipoic acid because they don't need to push or pull the heavy metals out of their cells and into their blood. So they just use activated charcoal. And the idea is that the activated charcoal just moves along your intestine, and it binds to the heavy metals that are in your bile. And then gradually you would poop that out and not reabsorb it. So the whole goal would be that your heavy metals that are in your bile in your small intestine would bind to the charcoal and be carried out through your stool. And if you do that every day for a year or two, that's the Yasko method. And I really like that. And I've done it for years, and it's very safe and it works, but it's slow and it's agonizing, and some people don't like it. But I say that you want slow sometimes. And if you're not sure if you're going slow or fast with this method, you can measure stool metals. You can measure the metals that come out of the stool, and you can see if it's too much or too little. And sometimes that will guide you. The next slide talks about clay. And so this is where some people take various forms of clay, and there's lots of different clay. And undenatured clay that's very, very vibrant and full of these little microscopic pockets, very active clay, will bind to heavy metals and it will bind to all kinds of things. And as it binds to it, its structure collapses and it becomes cement. I spent the summer one year at the University of Arkansas in Bentonville at the library, reading the books of Hippocrates, because they're there for us now. They're written, and you can see one side is Greek and one side is English, and then there's another version that's in Latin, and you can read it all. And I don't read those languages, but I read English, and so I could read his writings and I could see all the stuff. And I read all those volumes that summer. It was really a lot of fun, many volumes. And during that process, I realized that Hippocrates spent a lot of time talking about constipation. He spent a lot of time talking about cleansing people. And he mentioned that if you use a clay based, he knew this was 450 years before Christ. He said, if you use a clay, even if it's a very vibrant clay, and you give it to a person, child or adult, you're going to make cement in their intestine. You're going to have to use water to get that clay out, that cement out. You're going to have to irrigate them. And so back then they used a straw, and they would just fill their mouth with water and blow the water up into the rectum of the child to clean them out. That was how enemas worked back then. They didn't have surgical tubing. They didn't have enema bags. They didn't have any of this stuff. They had to cut reeds from a river and blow the water gently into the child's rectum. That's how it worked in Hippocrates' day. So if you choose to use a clay method, just understand that as that clay binds, it creates a cement that may often have to be removed from your colon by some kind of colonic irrigation, which means going to a colon hydrotherapist, which I think is great, doing home enemas, which I think is great, but you may have some difficulty of getting that complex out once you put it in. So it's very important for us to know about that. And our next slide here shows what some of that can sometimes feel like. And so it can be difficult for a person to clear it all. And there can be problems. In fact, one of the ways that we use to get the heavy metal aluminum out of a person, and aluminum is arguably not a heavy metal, is Fiji water. Now, I'm not endorsing Fiji water itself. I don't sell it. It's just that Fiji water has a high silicic acid content. And Dr. Christopher Exley and one second here. Dr. Christopher Exley and Dennis Krause talked about this book, which is How to Make Your Own, and also why it works and how Fiji water works. And they basically said in their research that they were able to save fish that were dead, and they were able to save humans dead from aluminum toxicity, because fish die first much earlier than humans do from aluminum toxicity. So they're the canary in the coal mine, if you will, or the carp in the coal mine. And so that use of some kind of silicic acid water will help bind to aluminum and carry that out of your brain. Whereas other types of silica, which are not silicic acid, will only carry aluminum out of your gut. They will not reach your brain, and they will not pull aluminum out of your brain. So that's why these guys advocated in their research. Again, that's Christopher Exley and Dennis Krause. They advocated 1 to 1.5 liters per day of some kind of Fiji water of concentration of about 30 parts per million, which is around 91 milligrams per liter. And that was enough of a dose every day for about 3 to 6 months to reverse the aluminum in Alzheimer's patients that were fairly moderately to advanced cases, people that had forgotten much of their short-term memory and only had long-term memory, and they reversed them. In fact, Dennis Krause in that book talks about his own mother and how she was able to reverse a terrible dementia in her 80s and get rid of the dementia using some water like this. And you can make your own at home, or you can buy it. And there's other brands that have it too. You can also detoxify using sauna. There are a couple of minerals that do quite well. Mercury is detoxified through the skin. Most metals are not detoxified through the skin. And aluminum, to some degree, is detoxified through the skin. Get in the sauna, follow the Swedes and the Norwegians and the Danes and everybody that does the sauna work, the Finns. It doesn't have to be terribly hot. You can use infrared sauna that's only 101 to 105 degrees. It doesn't have to be very hot. You just have to really get that infrared rays into your body from infrared light bulbs. You could also use traditional sources of heat. You can do hotter saunas. That's fine. There's steam and dry saunas, wet and dry saunas. There's all kinds of different temperature ranges. Just make sure you're safe. Most people do sauna sessions about 15 minutes at a time, and then they get out, because you can really dysregulate your temperature, especially if you've got heavy metals on board. So remember that that's a very useful way of doing that. So chelation therapy can be extremely beneficial for some people, and it can be a real savior, but it's a heroic medical method. And so every heroic medical method is a hammer, and it uses a brute force method. And that means that sometimes it's going to disturb some people a little bit more by flaring up an autoimmune condition, or by redepositing into another tissue and creating neurological type symptoms or other types of symptoms. So use it with caution and use it wisely, but it's a very, very interesting tool. And I think that there's ways that intravenous nutrition doctors and intravenous drug doctors and intravenous chelation doctors can work together with us holistic doctors that are chiropractors and naturopaths and homeopaths and every other kind of natural doctor to really come together using science to help a person get better, because we really don't know what the best thing is until we get in there. There's no way to know ahead of time if a decision is the best thing for a patient or if it might have a side effect. So you have to use informed consent and roll the dice and make yourself strong enough, if you can, to be able to withstand the side effects of your therapy, whether it's cancer chemotherapy, which is the ultimate in side effects, or something as simple as some kind of home remedy. So that is chelation therapy in a nutshell for you.